Good morning, ma'am. My name is TRISHA KAYELA ARIAS, a student midwife from Palawan State University. So today, I am going to perform the administration of intravenous infusion.
Assemble all equipment and bring to bedside. We have IV solution, IV infusion set, tourniquet, IV stand if meron, cotton swabs with disinfectant solution, non-allergic tape, arm board if needed, and clean gloves.
After we gather all the equipments, I let us identify the client and explain the procedure to the client and make sure that there is correct and adequate lighting.
Next procedure is to perform hand washing. And then, make sure to wear protective gloves. Prepare the IV infusion solution and tubing. First, let's check the type, clarity, and expiration of fluid. But before inserting the spike to the IV solution, let's make sure that the flow regulator is closed. Then, remove the cover of the tubing and IV solution. Insert the spike into the opening site of the IV container. Then, clamp tubing and squeeze drip chamber, allowing the solution to flow until almost halfway of the chamber. Open the clamp and allow the fluid to flow until no bubbles are visible and close the flow regulator. Then, suspend the IV set on the IV stand. Choosing the site of insertion. Assist the client in assuming a semi-Fowler's position if permitted. Locate for the visible vein for venipuncture and apply tourniquet 5 to 6 inches above the site. Next is to check the radial pulse below the tourniquet. Then, ask the client to close his fist. Then, palpate the vein. Clean the insertion site with cotton swabs with alcohol in rotating motion from the inner to the outer part. Then, allow it to dry. With a non-dominant hand, hold the skin of the client taught to visualize the vein. Insert the catheter and initiate the infusion. Insert the IV catheter gently with the bevel up at a 15 to 30 degree angle through the skin and into vein in one thrust. Advance the IV catheter and stylet into the vein until the hub is 1 millimeter to the puncture site. Once blood appears in the lumen of the needle or you feel the lack of resistance, reduce the angle of the catheter until it is almost parallel with the skin and advance the needle and catheter approximately 0.5 to 1 centimeter further. Holding the needle portion steady, advance the catheter until the hub is at the venipuncture site. Apply gentle pressure over the vein just proximal to the entry site to prevent blood flow and remove the needle from the plastic catheter. Release the tourniquet. Remove the protective cup from the distal end of the tubing and hold it ready to attach to the catheter, maintaining the sterility of the end. Attach the end of the infusion tubing to the catheter hub. Open the clamp and regulate the flow. Next is to anchor the needle firmly in place with the use of transparent tape or dressing directly on the puncture site. Let's make sure na the needle is secured with a non-allergic tape, and apply an arm board if needed. Next is to adjust the flow of the solution according to the physician's order. Calibrate the IVF bottle and label the IV fluid as to date and time of insertion and the type of gauge of catheter or needle used. Collect all equipment and discard waste according to hospital policy. Wash hands. Document the time and date the infusion was started and the type of solution and medication used. Lastly, check the infusion site after 30 minutes for signs of edema or infiltration. And for discontinuing an intravenous infusion, first we have to check the doctor's order to discontinue the IV infusion and IV medicines. Next, prepare all equipment like IV trays, sterile cotton balls with alcohol, pick up forceps in antiseptic solution, kidney basin, and Band-Aid. And then, next procedure is to perform hand washing again. Next is inform the client of the discontinuation of the infusion and of IV medicine. Then, close the clamp of the IV tubing. Next is to moisten the adhesive tape with a cotton ball soaked in alcohol and remove gently. Then, remove the needle gently by pulling it or the IV catheter. Then, apply pressure on the site with the use of cotton balls and place the dressing over the venipuncture site. Then, check the needle or IV catheter for completeness. And discard all waste materials according to hospital policy. And wash hands. And lastly, document the time and date of discontinuation.